Yes, sir, we are on now.
All right.
Vidhi is from your team of IIM.
Yes.
Okay.
So we are online now. So good evening, everybody, and welcome to the IIMA Healthcare Alumni Special Interest Group webinar series. As many of you know, the Alumni Special Interest Groups at IIMA are platforms that bring together alumni, faculty, and students and leverage the collective intellectual resources engaged in specific areas such as healthcare, education, technology, analytics, public policy, marketing, etc., to bear on the most challenging issues of our times. Now, faculty and alumni are already making stellar contributions, but the ASIG platform allows them to collaborate with each other much more intimately and to engage with industry and practitioners in a much more multifaceted manner. To facilitate this interaction, we've created 14 such ASIGs and more will follow in due course. The ASIGs have several activity tracks with webinars being one of them. The webinar series itself brings the thoughts, views, and expertise of renowned experts to the IIMA community. As part of the healthcare webinar series, we have earlier discussed industry-government collaboration, emerging digital healthcare scenario, investors' perspectives on opportunities in healthcare, and reimagining the future of healthcare. COVID has, jolted the world economy in several ways, but the healthcare sector in particular has had the unenviable task of being the frontline responder to the crisis while evolving at the same time. This shakeup has presented an unprecedented opportunity to AYUSH and other traditional medicine systems elsewhere in the world, such as TCM in China. Recognition of its relevance and growing importance comes also from the World Health Organization, which in November announced the setting up of the WHO Global Center of Traditional Medicine in India to do a deep dive into the opportunities that AYUSH presents as a next generation business opportunity in India. I am very happy to have a very distinguished panel with us today. We have with us Dr. Bhushan Patwardhan, Vice Chairman of University Grants Commission. We have Dr. Narendranath Mehrotra, Convener AYUSH Collective and founder Jeevaniya Society. And we have Dr. Lal Hingorani, CMD of Pharmanza Herbals Private Limited. Welcome, everybody. The session will be moderated by Mr. S.P. Dangayach, PGP 1972. Mr. Dangayach is a distinguished alum of IIM Ahmedabad with India-centric mindset focused on social, economic, and technological spheres. He is founder trustee of Innovative Thought Forum, an India-centric think and act tank. Mr. Dangayach has helped in building brand Syntex into a formidable entity, offering innovative and affordable solutions across sectors during his long career of 43 years in leadership positions, including over a decade as managing director. He's on several boards as independent director. He's also on the board of governors of IIM Udaipur and Oro University, and he's currently national vice president of Arogya Bharati, besides being a patron of Global Homeopathy Foundation. We look forward to an exciting session. Now I hand over the platform to Mr. Dangayach to take over the proceedings.
Thank you very much, Anurag. Dr. Patwardhan, Dr. Mehrotra, Dr. Hingorani, and all my friends. It's my delight to coordinate and moderate the session today on AYUSH, the Nextgen Business. As we are all very well aware, India has had a pluralistic health system since independence. We have a very long tradition of millennia of Ayurveda and the traditional systems of medicine, and we have been trying to integrate them right, say from the time we got the independence. We had created a separate department under Ministry of Health, which was called Indian System of Medicine and Homeopathy, ISM&H. And in the year 2014, when Narendra Modi ji took over as the Prime Minister, a separate ministry was carved out, which was called AYUSH Ministry. And as you know very well, it's a ministry which has got 6 different systems of medicine or healthcare under it. Ayurveda, Unani, Siddha, these are the Indian systems of medicine. Then we are having Tibetan system of medicine. Besides this, we have got homeopathy and obviously yoga and naturopathy. So there are 6 different streams and each one of them has got unique characteristics. The current pandemic, as a matter of fact, has thrown up many challenges. And as we are knowing very well, AYUSH also has contributed to tackling the current pandemic by way of giving many immunity boosting solutions, as well as many other ways by which this particular disease could be prevented. AYUSH per se is not a new business opportunity. It is a huge business opportunity which has been tapped, say by many entrepreneurs, starting, say with people like Bhushan, Himalaya, Dabur, and we have recently seen the emergence of Patanjali as a very formidable player in the field of healthcare. We, as a matter of fact, in the year 2017, came up with a national health policy, and for the first time, the government recognized the importance of, or probably accentuated or clearly spelled out the importance of promotive, preventive, rehabilitative, and palliative, along with curative. And that naturally is something which is being tried out now in many different ways. We also saw the emergence of national education policy last year. Commonality between the two, policies is that there is a need and there is a sense and there is an urgency of integrating the different knowledge systems. I'm pleased to tell you that Government of India has now created a special kind of a cell under Niti Aayog, which is now looking at formulation of integrative health policy. In my opinion, it is very clear that integrative health policy is going to come up. I'm delighted that this is something which is going to possibly bring about the integration. Without talking about the other things which I will come to later, I would straight away invite Dr. Bhushan Patwardhan, who is, as the Anurag said, he is the vice chairman of UGC, and he also happens to be the vice chairman of the committee for national for integrative health policy, which is being worked out by Niti Aayog under Government of India. Dr. Patwardhan is a biomedical scientist. He is on the board of National Academy of Sciences and medical field. He has got an excellent track record in terms of creating evidence-based Ayurvedic medicines through Ayurvedic biology, ethnopharmacology, natural product drug development, and integrative approaches to improve public health systems. He is the founder and editor-in-chief of Journal of Ayurveda and Integrative Medicine, JAIM, which is published by Elsevier and recipient of many orations and awards, including Sri Ramnath Chopra Oration, Valdemar Hapkian Oration, and the others. He has written many articles, many books, and he has got several patents to his credit. Dr. Patwardhan is currently, I would say, the best person to talk about the opportunities that are going to emerge because of the new policy that is going to emerge. So I would request Dr. Patwardhan to share his wisdom and knowledge with us on this particular subject, which is looking at AYUSH as the next generation business because of the fact that the scientific approach, when integrated in AYUSH, is going to bring about huge transformations and business opportunities. Dr. Patwardhan.
Yeah, thank you, Dangayach ji, for that kind introduction and remarks. And it's my pleasure to be with all of you, the distinguished IIM Ahmedabad alumni and my fellow speakers. I will be very brief. And as mentioned, I must compliment Dangayach ji for bringing this very important question upfront on table, AYUSH Nextgen Business, especially in the post-COVID era, we need to really think about it. And I will make a very short presentation and I'll start sharing the screen. I hope you are able to see the screen now. And let me make it a full screen and go to the, yes. So I will just speak about the AYUSH as Next Gen Business, and First, I would like to really start with while COVID has opened up a lot of opportunities for us, despite many adversities. But these opportunities are also countered by the situation in which we are really witnessing several challenges, several clashes, and several influences, on us. The challenges are we are living in some kind of a medicalized society, and we have started believing that by taking medicine we will get health. So our entire model, business models, are based on giving medicine and not about providing health. And I personally feel that while the evidence-based medicine, what we talk about, while because of science and technology advances, the evidence is going higher and higher evidence level, the ethics levels are going down, And so there is on one side, there is a curative practice and with market forces, this kind of a medicalization of the society has happened. We talk about healthcare, but I am asking this question, are we really giving healthcare? In reality, we are giving medical care, but under the name of healthcare, we are actually taking people to the era of health care. We are actually scaring people. Look at this advertisement in the newspaper on the screen, Do you have high blood sugar? Do you have high blood pressure? And then they will paint very scary picture. And same scare we have seen actually in the COVID era also. There is very hardly any reliable data that is coming up. The WhatsApp University is going on in full swing, and people are getting scared. They don't know what is the real situation. So healthcare actually is about primary care, family medicine, health promotion, and disease prevention. When this fails, then you need something to cure diseases, which needs hospitals, which needs surgeries, which need drugs and diagnostics. But today our main focus has come on this cure. And the preventive aspect has fallen down. As against that, our own Indian philosophy is completely based on the concept of swasthya. And I would like to differentiate swasthya from arogya, because arogya is also connected with roga, like health is connected with healing. So we should talk about wellness, prevention, and swasthya more than, and our business models also should, future business models should not be dependent on health care. Well, I feel that any business model which is based on people's agony and people's pain cannot be sustainable. We have to devise some new models which are more humane and which will balance actually need versus greed. This point I wanted to make because on one side, when the world is going towards minimalism, on the other side, there is a scary profiteering that is going on in pharmaceutical industry. And on the screen, I have given just one example of anti-cancer drug. The kind of profit that industries are booking for this kind of life-saving drugs is really something which is worrying. I feel that many new industries I am witnessing which are coming forward, who are really believing in this kind of a triple bottom line concept in which planet, people, and profits are considered with corporate social responsibility. This is a good sign. The progressive pharma industry, the new they wish to focus on the root of the problem and not just treating disease. And their new business models, I'm seeing that they are more based on prevention and early interception of the diseases. And I think that this kind of a business and profit linked to suffering and agony slowly will change into how we can give more and more wellness, more and more happiness to people. And this should be the business models where I feel AYUSH can play a major role. When I talk about evidence and research, I must tell you there are enough studies and evidences that are coming up for and against, but we must remember that a very critical survey, scientific study done by John Jeevaniya from Stanford has shown that 85% of the biomedical research is actually going into West. It is not going. And so I'm asking this question, for whom today scientists are working. I am a researcher, so I am asking this question to myself, whether we are working for people or whether we are working for business. And as IIM graduates, many of you are business leaders, many of you have been captains of industries. So we should ask this question. I go back to one of the very interesting concept made by Dr. Mashelkar and Prahlad, published in HBR, talk about MLM, more from less from more. So more performance from less resources, from less cost for more people. And I feel that this particular innovation, for MLM innovation is very much possible with the help of AYUSH. People actually, today we are in a world where we are saying as an industry also that your health is in our hand, So we want to take care, we want to take people's health in our hand by giving them any medicine or any other thing. So this should not be the case, we should, either it should be your health in your hands or our health in our hand, because health, I think, is very precious to be outsourced to doctors and hospitals. Health cannot be acquired by just merely taking medicine. People need simple ways to achieve health and prevent diseases. People need healthy diet, healthy lifestyle, mental peace and relaxation, primary care, emergency measures, and surgery can come from allopathy, and holistic preventive aspects can come from Ayurveda, yoga, and other systems. So health assurance is also required in addition to health insurance to cover people, So today we are actually in an era of medical care, which we should transit to preventive care, and slowly we should actually go towards real healthcare or wellness. The traditional and modern, what are we talking about? We are talking about food or we are talking about medicines? We are talking about nutrition or we are talking about supplements? We are talking about family chats or mobile apps, the living rooms or home theaters, home kitchens or Swiggy-like delivery systems, consumerism or minimalism, illness or wellness. These are some of the questions which we should really put in our drawing boards and start to think about it. Dangayach ji mentioned about this Jeevaniya app. I must tell you that the way in which AYUSH has performed during these years is really appreciable. Ministry of AYUSH silently has been doing a lot of work and a lot of service. They are not really making tall claims, unnecessarily confusing people, but they are doing something very silently to empower people to prevent diseases, to improve immunity. And I think that tomorrow's the world is going to be revolving around two important aspects, in industry also. It is immunity and inflammation. The whole new industry, including pharma industry or wellness industry, will revolve around immunity and your inflammation, control of inflammation and boosting of immunity. These two things are going to be very important in future. And I would also add the third component to that, and that is insulin resistance. Because due to metabolic syndrome, we are also have to really target this insulin resistance as one of the important target. I believe that based on our own work, which I'm not going to discuss here today, but we have a lot of scientific data, which shows that AYUSH has strengths. AYUSH has strengths in prevention primarily to improve your immunity through different kind of rasayana drugs or different kind of processes, which are able to really lead to healthy aging, controlling of inflammation. So the regenerative processes which are there in AYUSH, all these are extremely useful. And I feel that excellent business models can emerge through this, taking prevention as a base. I am also a member of the recently appointed Lancet Commission. In Lancet Commission, many business leaders and teachers from Harvard Business School like Tarun Khanna are there, and from India, many good scientists are also members of this Lancet Commission, which is trying to reimagine Indian healthcare. And we are trying to put this very, very strongly that the public health priority and the priority to prevention should come up front, when we are talking about India. And when we are talking about health or healthcare in India, we cannot forget AYUSH systems. We cannot forget traditions. We cannot forget our own roots. And through that kind of integration, bringing in best from modern medicine and best from AYUSH, barring all the egos and war of turfs keeping aside, I think we should work for people. And if we are able to do that, I believe the future will be much brighter, not only for business, but also for people. So with this, I will stop, but I will come back again if any questions are needed. I have not expanded many of my points, but whatever I have made statement, I can give you necessary support evidences or justification in support of that. Thank you, Dangayach ji, for inviting me to share my thoughts. And namaskar. I'm going to post one link to the editorial from Journal of Ayurveda and Integrative Medicine. And my question to all of you who are listening is, listening to all this, do you really go in favor of integrative approach wherein we bring best from both the systems, keeping people's need upfront and not necessarily the professional egos and silos, you know? So this is my question. You can just answer yes, no, or no comments after you go through the editorial link I'm putting up just now in the chat box. Thank you very much and namaskar. Jai Hind.
Namaskar. Thank you very much, Dr. Patwardhan, for giving such a scintillating start to the webinar today. Your obviously approach to patient-centric kind of paradigm in place of the current pathy-centric paradigm is something which we have to really ponder and which we have to really think about. And I must also tell my friends here in the audience that Dr. Patwardhan is really very innovative thinker, and his articles on reimagining Indian universities is also being discussed in all the quarters. Going forward, obviously, he is the one who is going to give us guidance in terms of integrative health policy and systems that we have to follow. We have now got the second expert on the panel today, Dr. Narendranath Mehrotra. Dr. Mehrotra is the former deputy director of CDRI, Central Drug Research Institute. But let me tell you, from the very beginning of his career, he has been very India-centric and very integrative in his thought process. He was responsible for initiating an AYUSH or Ayurveda department in AIIMS. He started Jeevaniya Society, which is working on obviously holistic living based on the Indian systems. He is a part of some Mission Samriddhi, which is doing phenomenal work in terms of improving the lives of the people. Dr. Mehrotra has been there on many of the committees of Planning Commission and the other government departments in terms of mainstreaming AYUSH. When ISM and H was there as a Department of Health, he was one of the key resources for Government of India in taking AYUSH forward. Recently, he has tried to bring all the people together from AYUSH under the banner of AYUSH Collective, where he's trying to see how all the people, researchers, the practitioners, and obviously the business people can come together. AYUSH Collective is an umbrella with which we are working to bring AYUSH center stage, following, I would say, scientific or the other rational methods, and to also look at the possibilities and ways by which we can have modern Ayurveda or modern Unani or modern Siddha or modern homeopathy. Dr. Mehrotra, please come and share your thoughts with the people here who are very keenly waiting in around 15 minutes. Dr. N.N. Mehrotra, please.
Dr. Mehrotra, you are on mute.
Naren, please unmute. We can't hear you. Please unmute.
Dr. Mehrotra, please unmute.
Sorry. Thank you, Bhushan. I must repeat that Dangayach Sahib is so kind of appreciating so much. Maybe I don't really deserve all that, but let's come back to the issue. I would not like to go into the formalities. I must compliment Bhushan for really putting the setting of the discussion for today. And that's really great of Bhushan. He has very innovatively and in a very precise and focused manner put forth the issues in front of the group. And that should make a lot of difference. Now, I would start from where Bhushan has left, because we have been in touch with each other for almost last 40 years, 35, 40 years. So we know each other's views, and we have worked together on many issues, including customized Ayurvedic medicines, the concept that we initiated in 1995 and around that time. And he worked on that Prakriti or Ayurgenomics after that, while I was moving to the health policy studies and with the health policy activities. So we have worked together on promoting the local health traditions across the country, not only of the Shastrik, the AYUSH systems, but also the folk traditions, the local health traditions, the tribal traditions, and so on. That's where, again, a very vast richness of knowledge resource exists. Not only in this country, it existed in all the civilizations, whether in India or in Asia, or China or Japan or Vietnam, or let's say even in Aztec and Mayan civilizations. So we have that understanding not only from the Indian continent, but also the global context. And that's what brings me to a point which I thought of making is the way the healthcare system has been usurped by the health industry, I call it. I have Dangayach Sahib is aware of the discussion that we have had on a person by name Ivan Illich, a Latin American philosopher who was involved in phrasing these issues as a matter of developmental philosophy, not only in health, but also even in education or in technology, where in health he talked about limits to medicine and so on. And the role that the health industry was already playing even in late 70s when he talked about limits to medicine, that the planet or even the rich countries like USA or USSR won't be able to afford this kind of expensive healthcare system. And we are all aware of how Clinton, in his very first tenure, talked about the expensive system from healthcare industry, which even America won't be able to afford. And the rest is history, the way the health industry has usurped the medical education to pharma industry, to diagnostic industry, and to all the rest of the whole thing has been converted from healthcare to health industry. The point that Bhushan raised about industry-based healthcare or people-centric health and wellness, that point. So I have total concurrence and agreement with Bhushan, because we have had similar thoughts shared for several decades. Now, if we look at that situation, I would like to just add a couple of more philosophical issues before I take on to the industry or the next-gen business approach that Bhushan mentioned about. In fact, in the Indian tradition, there is a record in Chanakya's writings in some places. There were three systems which were exempt, or which were where the industry was kind of prohibited. It's called Nishedh. The word is used has been Nishedh. That is the education system. The education system in any country, whether it was from Takshila, Nalanda to the Gurukula system. The judicial system, that pre-British advent after 1857, when the British Crown took over the Indian governance, that the judicial system was introduced here, or similar system introduced elsewhere in the world. And the third was healthcare system. So in these three systems, Vyapar Nishedh was the concept. And unfortunately or incidentally, today these three systems are the biggest industry globally. Now, these are distortions from the traditional understanding of knowledge systems to the ground reality of the global market or the global village, in whichever context we take it. Now, in that setting, how do we look at it? While Bhushan's been talking about what he suggested today, people-centric industry, or what kind of business model we will have, the future health industry of immunity and inflammation and so on, of the wellness industry. The industry would, wherever it goes, it would convert that into the industry of the profit making, where we had the concept of Shubh Labh. Now, this concept of Shubh Labh is very important in industry. The Indian tradition or ethos were never against it, industry, but it referred to industry from linking it with industriousness, and industriousness resulting into profit, which should be Shubh Labh. It cannot be Ashubh Labh. And if you just take an example, many people are aware, when the pharmaceutical pricing system was introduced in late 70s, the DPC or Drug Price Control Order was introduced, and the National Pharmaceutical Pricing Authority was constituted, and they started preparing dossiers on the actual cost of various drugs which were in market. And I'm not going into the history of that detail. I'll just give you one or two examples. One classical example was Baralgan ketone, produced by Hex at that point of time. The bulk material of Baralgan ketone was that time selling at about 25,000 rupees, around that cost. And when the NPPA calculated the pricing of, or the costing, they said from costing to profit, the formula that they developed, where they had something like 30% profit margin post expenses, all expenses covered. And they said it should not be more than 13 to 14,000 rupees. So they said it should be brought back from 25,000 to 13,000 rupees or so. Hex said, no, that's too little. We'll be going into red. We will rather stop production than continue its production and so on. And when there was this issue was further analyzed, Hex agreed, okay, we can provide you at 16,000 rupees a kilo. You fix the price at 16,000 rupees a kilo. So from 26,000 rupees, they voluntarily offered 16,000 rupees a kilo. Now you can imagine the profit margins that have been there. From that kind of margin to the Shubh Labh concept, the profit margins, there are many reports and books like Silverstone's book about profiteering from medicines or pills for profit, where he gives examples of many drugs which were made available through R&D and technology development. But industries did not take them up because they would not settle for anything less than 400% or 500% profit. So the entire concept of Shubh Labh doesn't settle with the industry of the current context. In the current scenario post-COVID, things have been changing. Things like AYUSH is coming. Now, unfortunately, even in AYUSH or in the alternate systems like health and wellness industry, many of these industries which are coming up, whether it's nutraceuticals or it is nutritional supplements, the simple concepts of food and nutrition, that food can be thy medicine, and how you can position it and market it, again taking it on to that kind of Ashubh Labh situation. Now, if it has to be people-centric, what kind of profit limits one has to put in? So even for the AYUSH industry, the pharmaceutical pricing system should work. And how do we do that has to be seen while sustaining quality. Now, from this point of the Ashubh Labh and to the industry with the unlimited profit, the quest for unlimited profits, which results in things like changing governments in various countries or influencing governments, or even killing people, like Ayande's murder was attributed to pharmaceutical lobby attacking them, or even the Bangladesh drug policy of 1983-84, where the pharmaceutical lobby went and met the President Irshad against Zafarullah Choudhury's proposition that they would go out of Bangladesh and not produce anything.
Mehrotra, 5 more minutes.
Yeah. I'm aware. So I'll come back to the issue. So from that to, if we take the next gen business, and as Bhushan says, AYUSH has tremendous opportunities. So the next business has to be from wellness, from health and wellness, and from health and wellness to curative and palliative production based on AYUSH largely. Now, if we look into that, there are two levels. One is within the government system, wherein even things like BIRAC and NASSCOM have offered a challenge on innovations. Many of you must be aware. They've offered a competition where those coming out with new innovative ideas can take on their innovations as startups, and the government would support them. And the proposal is to come out with low cost input or low resources input industrial startups for healthcare delivery in decentralized situations, like 60% of the population which does not have access to healthcare. So with accessibility and affordability, if the startups come in the healthcare industry, the entire health and wellness centers which are supposed to be coming up. They were originally supposed to be the wellness centers, but they have been converted again into upgradation of the sub-centers, which should not be the concept. While the AYUSH has been offered 12,500 centers, but the 1,37,500 centers are being offered to the modern pharmaceutical healthcare industry. Now, if we shift at least all these 150,000 health and wellness centers to be AYUSH-centric, where we promote from herbal gardens to home remedies to things like Dadima ka batuas of the regional localized systems, but ensuring SOPs, ensuring protocols, ensuring quality standards, then that could change the entire scenario. And many startups, the localized startups with very limited investments could be provided opportunities to get support of BIRAC, and even NASCOM is willing to provide them support. And there is tremendous opportunity. 150,000 health and wellness centers across the country, serving the 65% population where modern healthcare industry doesn't reach anywhere. So that's one area where there is tremendous scope. The other scope is, let's say, with ASHA and Anganwadi workers to the midday meal systems, where the midday meal systems like Akshay Patra and many other foundations have been involved. Why can't we have the midday meals according to the prakriti of children? If we divide the children in a given, let's say, block, where there will be something like 30,000 to 40,000 children in the midday schools, meals have to be provided. So there could be enough requirement for the Vata favorable food or the Pitta Prakriti favorable food or the Kapha Prakriti favorable food. And that could bring you the opportunity of setting up the food supplement industry for the midday meal scheme. And that would not be the conventional food of giving one egg every day or one banana every day or this panjiri every day and kind of food and nutrition supplements which are given to all the children, and the quality and all those issues can be. So that's a very important next gen business opportunity that exists in about 2.5 lakh schools, primary schools, and about 1.5 lakh secondary schools, even in the government. Even the private sector, there are many schools, charitable institutional schools, where these schemes are available, and with a reasonable opportunity of returns also, this can be possible. The third area that I would like to talk about is the organic food industry, which is again growing at a fairly fast pace, but the high price which has been put on the tag of the organic food with certification on one hand, and the health returns of the thing will not go for very long. If large number of farmers start producing organic food or including organic herbs, we may have export markets which could be high priced, but for the local consumption, for an average town and the average small town or bigger
2 more
town,
minutes, sir.
Yeah, I'm winding up. I know my limits, so don't worry. I'll take care of that. So that's another area where from food to herbal products, there is from within the country, small town to bigger towns, from small towns where self-help groups and FPOs to the bigger towns where the organic certified food and herbs for export market. That's all health food, healthy wellness, consumer-centric, Shubh Labh context. The last point that I would like to touch is the entire question of the herbal cultivation and quality control issues. There is so much of confusion lying, because still more than 85% of the herbs are from the forest areas. With the degradation of forest areas and no proper systems being followed of the harvesting of the sustainable harvesting of the forest produce of the herbs, and the losses that happen and the quality control issues post harvest and management, the way AYUSH clusters were promoted by the AYUSH ministry in the year 2002 onwards, but they couldn't, most of them could not succeed for various reasons. I was fortunately an advisor to one of the clusters and have been associated with more than one. And when the GMP was introduced in AYUSH industry, I would just like to add a point that GMP for Ayush industry was started even before it was implemented legally on the pharma industry, the Western pharma industry, which many people are not aware. That whereas as I was a member of the Ayurvedic Pharmacopoeia Committee, the standards didn't exist. They even today don't exist for many of the drug Ayurvedic or Ayush products. And whereas they are all available for the Western pharma, this thing, voluntarily many companies would follow the FDA and all those things for export purposes. But it was not binding on them. But it was made mandatory on the thing without realizing how would these small Ayush units survive and grow and so on. So the empowerment of the herbal Ayush industry, and particularly for the homeo industry, where the regulation still is very hazy, and the confusion between the Ayush and the Western pharma industry controlling the homeopathic guidelines, so that they cannot even have trials of nosodes being started, where a lot of clinical trial opportunities, or whether the clinical trial opportunities in the Ayush protocols based on the Prakriti or Mijas or constitution in homeopathy could be taken up. So clinical trial industry based on the Ayush principles, but clinical parameters, evaluation parameters, which would be providing new therapeutics coming in a Ayush oriented industry. Now, there are several of these opportunities, from the grassroots midday meal to clinical trials to new products being developed based on WHO parameters for Ayush drugs. So I think I'll stop here.
Thank you.
And,
Thank you.
can come back to my questions.
Yeah.
Thank you. Dangayach.
Yeah, thank you very much, Dr. Mehrotra. You have given us such a wide, expanse of the possibilities. But I'll just pick on the, the last one. And you did make a mention that there's a huge opportunity even for the clinical trials and clinical research. The moment that we have got appropriate new drug and clinical trial rules which are relating to Ayurveda, Unani Siddha on one hand, and homeopathy, there are going to be immense business opportunities in even carrying out those researches and validation. The moment you are in a position to make products which are for the international market through through the herbs and through the other things, you can open up very big businesses. And this has been done very, very well by Dr. Lal Hingorani. Dr. Hingorani is a PhD from IIT. He worked for around 20 to 25 years in the biomedical or allopathic industry on APIs and other products. And thereafter, he was involved with reverse pharmacology and research in Ayurvedic and herbal formulations. And he worked with people like Dr. Ashok Vaidya for some time before he set out to create Pharmanza Herbal. And Pharmanza Herbals Private Limited now is one of the leading exporters and manufacturers of high quality Pharmaceuticals and the herbs. So Dr. Lal Hingorani is a classic, you may say, technopreneur, a technocrat who has then become a successful entrepreneur. And he is obviously knowing a lot about the creation of, you may say, Ayurveda, or you can say, say Ayush parks or herbal gardens, or herbal valley, or Ayush valley in the country. So Dr. Lal Hingorani, who's an entrepreneur, who has built a business around one or two components of the Ayush, will be able to tell us what kind of opportunities lie ahead of or for us for satisfying markets in India, or creating markets in India, and then obviously creating markets internationally. Dr. Lal Hingorani, please.
Thank you, Dangayach, and IIM Alumni Association. You have given a very high profile of me. And after Dr. Bhushan Patwardhan and Dr. Mehrotra has spoken, it's a little difficult because they have been talking about Shubh Labh and Ashubh Labh and all these things. Industry is about Labh only. And what is Shubh and what is Ashubh, that is the people have to decide. If you say Shubh Labh and all these things, and okay, the DPCO and the ministry would like that pharmaceuticals should do less profits, and if you do less profits, the income tax will come behind you. Why did you make less profits than the other companies? So you are not giving the exact this thing. So let me just share my screen. Can I? AYUSH Nextgen Business. The points that I'll be covering is global market for nutraceuticals, global ingredients market. Like your APIs in pharma industry, this is an ingredient market exists for the herbal products or Ayurvedic products. Then Indian export of Ayurvedic and herbal formulations and Indian exports of the natural ingredients. Asia Pacific market, changing patterns, regulatory segments which can give results, the low hanging fruits, what they call. The global market for nutraceutical is about 382.5 billion, major being the weight loss segment, which is a major problems in the Western world. And the global extract market, which is ingredients, what we call, is $23.7 billion in 2019, going to be 59.4 billion by the year 2025. Now, it's growing at 16.5%. We are, Indian share is about, major Indian companies are placed here, and Indian share is about $1.4 billion, which is about 5.8% of the this thing market. And Chinese is 31% share. So we have a lot of scope in this. A lot of work can be done to make it bigger in this segment. The European market is quite big, and European market is more lucrative also, but bigger market is American. Most of the Indian entrepreneurs are going into the US market. The European market, you need a lot of registrations and all these things. The US market registrations are low. The registrations have come, but the people who are right now with the new president, the president had put it on hold like for some time. So that's why it was a good like for the industry. So, the Asian Pacific market now, that is the Indian natural extracts, which is forecasted is 7,100 crores 2019, which will go to 16,000 crores in this one. The extract market that I'm talking about. Little difference is coming because being a member of a Chef Excel, I know this year our exports were about $1.4 billion from India. The exports of the Ayurvedic and herbal products is $350 million. And that includes all the toothpaste, the hair oils, all these products are included in this. And major products which are going are not the medicinal products, because very few countries are taking as such the medicinal Ayurvedic products, but they are taking Ayurvedic products which are nutraceutical. They go and sell it as a nutraceutical in that market. Some of the countries are now accepting Ayurveda practices, like in the US also, the California has accepted. California, you can go and practice your Ayurveda also, but other states are not as yet coming forward. Then some of the countries like Korea, South Korea, CIS countries, there you can register the products and sell them. And then the natural extract market is having a very good growth of 22% forecast for 19 to 23. Now, looking at the products now, what are the changing patterns that is happening? And changing patterns are like packaging. Packaging is becoming more this thing. If you see this paper boat, initially they started in Indigo flights giving this drinks, and initially they were the traditional Indian drinks they were giving. Now they are giving all the juices also in that. So the packaging and all this thing, the concept that they brought, it became very, very popular. I don't know if anybody doesn't know about this paper boat. And then increasing awareness towards the organic products, people are going towards the organic products, and a lot of people like organic products, though the quality is still a question mark in the scenario. New age marketing products like multi-level marketing have come up. If you see Amway and Herbalife coming into the Indian, and Amway is doing almost 1,500 crores turnover in India. Herbalife is not behind that. these companies have started a different thing, approach multi-level marketing in that. So these are things that is to be changed, and a lot of Indian companies have not come up with MLM marketing, and their turnovers are very good, like in this segment. Then food safety norms have come in now, and frozen desserts versus ice creams. Now you see a lot of products which are coming up, confectionery items, chocolates, and all these things. They are getting a lot of herbal products in them, and natural extract like turmeric, which has been, and a lot of work has been done on the Alzheimer's this thing. It is become a very big product for the brain health, like, and recently it is being sold for arthritis also and all these things. This product is the first Indian product to be like on the #1 nutraceutical in the world. There was a problem of the its absorption and all these things. So a lot of formulations have been developed in India and abroad, and these formulations have found they've been branded and doing quite well in the international market. The international innovations are like firewood drink, energy drink for truckers to keep them awake, which has definitely only your the product which is you will not like, but that's selling like anything. The new innovation has come like gummies for elders, then turmeric coffee, hemp supplements, functional foods, and innovative delivery forms. So if the pharma companies come into this segment, like in a nutraceutical segment, the innovative delivery forms will be more and more will be available, because herbal products, Ayurvedic has its, if you read Ayurveda very, very carefully, you know that in those days also they were knowing about delivery. They were knowing about what kind of products to be added together so that some of the compounds, they get absorbed. Like Trikatu was there in about 100 formulations of AYUSH. They found out that it contains piperine. That's why the piperine became a product for absorption of the lot of vitamins as well. There is a ghee preparations are there. Then asavas and aristas are there, but they are little older formulations. So some new delivery, innovative delivery forms out of this has to come out, which the customer of today requires, and that kind of products will be there. Like now, regulatory sides, there is a different set of problems than pharmaceuticals, but registration process is much easier, and there is a lot of scope for pharmaceutical companies to develop better formulations. That's what I was saying, because better formulation is the one that is required in this, because if you see the ones which are very popular today, the biggest this thing segment in the USA and in the Europe is your gummies, which nobody could have thought gummies were being eaten by the children. And suddenly now adult gummies have come up, which are selling like hotcake for all the vitamins as well as herbal products. So something like this innovation is required. Again, where you want to go, like as a nutraceutical or as a botanical drugs, most of the countries have the law of registering a botanical drug, which is easier than the pharmaceutical registration. So botanical drugs, you can go there, go with the toxicity studies and the clinical trial protocols, and you can register them. There are very few products which are registered right now, but Korea is almost 30 of them registered by now, and it's a quite big market. China has got some registrations. Then your CS countries have registrations where they have a lot of botanical drugs which are selling as drugs, not as a nutraceuticals. And low-hanging fruits in this Ayurveda are the ones where the modern medicine does not have any answer. Like giving you an example of the fracture healing, there's nothing available. Like you have to give something injectables for that fracture, which are the osteoporotic products available. That's what they give in the injection if the healing is not occurring. But Ayurveda has got very good products. We have already launched. We launched a product called Cissus quadrangulosus under the name Union, and afterwards one more product, Dalbarja Sisu, under Reunion, and that is being marketed by Eris Pharmaceuticals from Ahmedabad. It's having a pretty good turnover of about 6 to 7 crores in a year. It's not like pharma, very big market is not there. There are certain issues with the Supreme Court judgment, so some of the doctors do not prefer to prescribe the Ayurvedic products. But these things can be sorted out by the government, as they are very keen. And if they once they sort it out and once the integration occurs, these kind of products will be very fast. Second is the chronic diseases. Chronic diseases may a person is taking a medicine for a long time. Like arthritis, you have to take it lifelong. You have a diabetes, you have to take a medicine for the lifelong. So in these cases, the people think that if it is a regularly you have to take, you have to think of something like safety. So if safety is required, then they look at the herbal products. So in these segments, you can be very, very successful very fast. You must have seen certain of the products in the market like Ortho, Dr. Ortho and all these things coming on the TV, which are being sold in the arthritis and all these things. Like that for the pre-diabetics also, there are very good products in Ayurveda. The government of India has done a lot of research on them. They are lying with the closet right now. They are to be explored and brought into the market. Then pediatric products like general health, gripe water, cough syrup. In pediatric products, like people want that herbal products to be given to the child. Cough syrup is a very big market, not only for pediatrics, but for the any other human. Like here, if you see IIMA, the one of the largest brands of cough syrup was Dr. Mom's, which was that brand was sold for 1,000 crores some years back to Johnson and Johnson's. So this kind of product can be like successful. India also, people prefer cough syrups or even herbal lozenges when they have cough. The biggest market which is going to be is a brain health and anti-aging, because now you see the lifespan is increasing of the humans. So brain health is very important. And during this COVID, we saw that this was one of the problems which was faced by the people who were remaining indoors. The depression and all these things that came in. Then a lot of people got Alzheimer's or memory loss in that cases. So this will be again very big thing. Besides, yes, as Dr. Bhushan and all these things said, both of them said it will be immunity as well as your diabetics and diabetes, and then inflammation, because inflammation has been found to be all the problems come out of the inflammation. Now, incentives to coming into this industry is government of India is making big herbal parks like your API parks are coming up. Government is giving an incentive that they'll be giving a water treatment plant of that, so you don't have to worry about the water pollution and all these things, because India was at one time about 25 years back when I was in API industry, all the APIs were being manufactured in India and very few were being imported. China was not there. Probably the consultants from India went
2 more minutes, sir. 2 more minutes.
About this. So now the contract farming laws have been finalized. So you can do, because there will be a problem like from where you are going to get these herbal products as the forests are drying up. So now contract farming laws have come. So that will be this. Then less pollution in this industry. The problems is the Biodiversity Act right now, which our association is still working with the government, and hopefully we'll be able to solve it. So there are a lot of opportunities in this industry, and as the market is going to increase, this is a right time to enter this. And whatever the results which have come out of this COVID, we also did some trials, and I wouldn't say trials, observatory things at the Dharavi in Bombay. We gave almost 2,000 patients there, and just 2 products. One was the lozenges to take care of the throat infection, and one was the Tinospora. there are almost 49 trials on Tinospora, which was carried out in this during this COVID period. And these two products have given very good results, because at that time, the additional product, which was allopathic product, which was given to these patients, was just hydroxychloroquine, which we have found out right now that it did not work at all. So whatever results were there, they were results because of these two products from the Ayurveda. And the people went back in those days, like, and we give it around May, June. So they went back to their home 4 to 5 days earlier than the ones who did not take these products. And only now we have to see, because market has increased nearly 50%. There's a growth in local as well as the export market. We have done a lot of work on our Tinospora, which is our brand is Tinofend, and we were selling it in the US market, and the market was not very good for that product. And suddenly this year we see that there's a growth of something like 300% in Tinospora. Like that kind of we are finding market in that area. So this kind of products will come up, and we have to only see that after post-COVID, whether the Indian population, because Indian population has been very
One
bad.
more minute, sir, please.
Yeah, just a minute, 1 minute, I'll take it. Because Indian population is very much wary about taking any nutraceutical or herbal products for the health. The consumption of the nutraceutical or herbal products or Ayurvedic products for just well-being is minimal in India. And if you see compared to the Western world, it's very less. Here people think that they are taking a good diet, they are eating all the vegetables and the fruits and all those things. They don't need this. So that's why this market was very less. Due to this COVID, people have started taking them. We have to see that how they are continuing with this. Like after post-COVID, whether the trend continues. Probably some other products than the immunomodulators will come up, because as I was saying, that's a lot of brain health issues will start coming in, and people will probably take something like for the depression or anxiety and all these things. They are remaining indoors, so for that these products will be, but market will be there. Now it will not go to again back to what it was before COVID. So people have understood that these things are necessary in their life. So thank you very much.
Thank you very much, Dr. Hingorani. You have given us a very wide perspective on what all is happening in the field of herbaceuticals, nutraceuticals, and obviously the dividing line between nutraceutical and the pharmaceutical is quite narrow. But this is something which we can tackle later, because the definition of nutraceutical or maybe the pharmaceutical is varying from country to country. I would like to only maybe say that the research part, which is today something that is being possibly labeled as inadequate in AYUSH, is being addressed in many different ways. CCRAs, for example, has got very good guidelines which need to be followed by the industry. Homeopathy does not have any, and Dr. Mehrotra said, in homeopathy, there isn't, at this point of time, a new drug or clinical trial rules which need to be framed. We have got, say maybe several questions on this, and I would first, like to take a question from Mr. Isar Duggal, who has raised this particular point in respect of clinical trials, protocols, or the systems to be established in AYUSH. So I would request Dr. Mehrotra or Dr. Patwardhan to answer this question. Dr. Mehrotra, would you like to take this question? Because you are not familiar with the new drug discovery and things like that.
Yeah, I would very much like to comment on that, because it was way back in, I think, late 80s and early 90s that I was in one of the committees of CCRAs at that time, and they wanted to talk about the protocols. And I suggested to them, but every time the lack of confidence and the mindset of the Indian system of medicine research people, whether it was in CCRAs or in CCRI, UM and I didn't have the discussions with the homeopathy people, that they said the protocols have to be accepted by the Western biomedicine protocol systems. We should have similar protocols, double-blind, placebo control, and so on and so forth. I said, of course, but even at that time, even in Nature and in Lancet and in British medical journals, there have been comments and there have been case studies presented, and there have been protocols coming out of reports of cases where whether it is question of case studies or post-observation studies or open-ended trials, there are several protocols possible. But because of the lack of confidence and the confidence that they had, these people are not willing to come out. And I followed that even when I came to Lucknow with the Ayurvedic college people, their MD students and the clinical trials that they would like to conduct. They would always like to copy a protocol of some Western trial. They were not willing to, whether it was the professors or the directors of Ayurveda and so on, they were not having the confidence of developing new protocols. And a classical example is the arthritis trial of Ayurveda Pharmacy Coimbatore, where the first trial when they had in the late 1980s or 1991, around that time, WHO insisted on trial for a single drug. And they said, you choose any Ayurvedic drug and conduct a clinical trial. They said, we can't have a single drug. They said, no, if you can do a single drug, we will accept. Otherwise, we will not accept. So they surrendered and said, okay, we'll take a drug and do a clinical trial. Nothing came out. That Ayurvedic drug was found as useless as anything else, because that was bound to be. That reminded me of a trial which was conducted in leprosy way back in 1956 on chalmugra oil and compared to Dapsone. And the similar results were found out. This was in 1956, Leprosy Foundation of India from Varda and the Health Ministry ISMNH with Kurup had conducted that clinical trial. Then I kept telling these CCRAS people that why don't you say that we will have a protocol where, depending upon the prakriti of the individual and the anshansh kalpana of the growth of the patient or response of the patient, our clinical trial will change, will change the drugs. After that first experience, then Krishna Kumarji and his student and nephew Ram Manohar, they said, if you want a trial, it has to be not of a medicine, it has to be the medical system, the Ayurveda. And that clinical trial, which they conducted in 2010-11, which was published in 2011, for the first time, had a series of about 16 odd drugs, and they made placebos of all of them. And of course, they did conduct the random double-blind placebo-controlled study. But that they also took the care of the prakriti and the way the patient responded. Even
sir, it was please brief, sir. Now we have got.
What I'm saying is, the protocols have to be according to the foundational principles of the pathy, of the AYUSH system. The clinical outcomes can be followed up, but you cannot fit the shoe, all fit in the same shoe. That has to be taken care of.
No, thank you very much. Thank you very much, Dr. Mehrotra. I would now turn to Dr. Patwardhan, and there is a question from Mr. C.K. Katiyar, and question is that IIMA is refusing to accept contribution of AYUSH in current pandemic. In view of strong opposition by IIMA, how will integrative health policy work? Will it remain on paper? So could you please address this question, Dr. Patwardhan?
Dangayach, I have already answered that question in the question answer box,
okay.
So I would save that time.
Okay.
But in short, these issues will be finally resolved by people, Monopolies and egos are not important than people's aspirations. So whether some professional body accepts it or not, if the medicine or therapy is safe, effective, and affordable, people will opt for it.
Correct. Yes, there is another question which I would like Dr. Lal Hingorani to answer. If we wish to promote Ayurveda internationally, then Ayurvedic products should be exported as drugs and meet whatever requirements are laid down by overseas regulators, including WHO, GMP, etc., etc. How will this affect export potential? So, Dr. Lal, could you please?
See, today we are exporting a lot of ingredients, but we are exporting as a nutraceuticals there. One of the products that we are exporting to Korea is as a drug. But for that, you have to have the regulatory requirements of the country. We cannot say that it is Ayurvedic and all these things. And even the quality assurance and their specifications and all these things, they take a decision. Like in Korea also, when we went, they took a decision, what they want. Like they saw our reports, our clinical trials, and they came up, they frozen some specifications for us. And on that basis, we are selling it there. And we are quite successful in that. And single herb also, we have done most of our clinical trials on single herbs. All the protocols are to be as per the requirement where you are selling the product. So on that basis, unless Ayurveda is accepted in those countries as Ayurveda, you cannot sell it as Ayurveda product. You have to sell it as a herbal product.
Okay. Thank you very much. Another question to you only, and this is from Mr. Anil Choudhury. As we are all very well aware, NMPB, National Medicinal Plant Board, has become very active. I believe, now it has been put under AYUSH or maybe some other, maybe ministry. But there is a very, very attractive scheme and program of National Medicinal Plant Board, and they've come with QCI, which is the Quality Control of India, Quality Council of India. The two of them have come up with appropriate agricultural and collection practices. Now, how do we promote their adoption? Because you are required to naturally source or procure these herbs from different places. So how do you kind of adhere or follow these standards?
QCI is doing an excellent job. We are actually working with them also. And most of the companies will be like middle and higher, bigger segment, they'll be going to them. They are giving training to the farmers, training to the even tribals, how to collect the herbs, how to start a quality control from the farm itself. So that kind of work they are doing. It will take some time because they have just started few years back. And in this 1 year was lost because of the COVID, and they couldn't do much of the trainings in this. We had asked them for some trainings. So NMPB is also coming up with a lot of things, and industry is also alike and very, very active in this, because people know that sustainability is required. It's not that the industry is not aware of that, because if the raw material is not available, industry will disappear. So industry people are also coming together. Somewhere now something has to start with this NMPB and the industry together. Then only some results you will see.
I think, Dangayach Sahab, I would like to comment on this question, just a very small point, because I've been associated with NMPB for quite some time. And actually in KVIC, I've been advisor to KVIC on these drugs when the GMP was introduced. And I was involved in training a large number of small units of KVIC, the master trainers, and developed a guideline or the kind of module for training on GMP. One of the suggestions which came out was that there could be warehouses set up, not only by the cultivated, but even by the forest corporations. One such example is in Madhya Pradesh, where I was there for 2 years on deputation also with the Madhya Pradesh Council of Science and Technology, where they would pool the herbal produce from the forests or the cultivated produce from the farmers, and have the bulk pool certified as the GMP compatible raw material. So if you can develop a system whereby if a farmer is producing a quintal or 2 quintal, or you are collecting a quintal or 2 quintal from one area in a forest, pool them together according to the training and guidelines that you provide, and pull them together and make a batch and test it, then many of these small units don't have the problem of getting each raw material tested separately. So A, it reduces the cost of testing. B, it provides you a batch of even smaller quantities of, let's say, a 50 kg bag or 100 kg bag and so on. And then a lot of testing cost goes down. Therefore, the price of the final product comes down. And these suggestions were given and I've talked to Lok Shastri also. They can probably implement it to make sure that the manufacturers get the GMP certified raw material, certified by the government, by the NMPB and so on.
Very practical discussion. And as you are very well known to Dr. J.L.N. Shastri, who's supposed to be the CEO of, I think, the plant board, medicinal plant board. I think, we can pursue. I've got one question of Dr. Bhushan ji, and that is with respect to the meaning of the term qualification in the medical world. As we all know very well, there is a bar on the practice by somebody who is not a degree holder in that respective, the particular branch. For example, an allopathic, the degree holder can, the practice allopathy, but a diploma holder in Ayurveda cannot, possibly be considered as capable of, practicing. So could you please tell us how are we going to achieve the integrative practice, whether an allopath who acquires a diploma in Ayurveda will be allowed, to practice, or we say an Ayurvedic doctor who acquires kind of a diploma in allopathy be also allowed to prescribe allopathy. So could you please, tell us what is the future vision of the government on this particular matter? And this is combining both education and practice.
Yeah, Dangayach, this is very loaded question. I think in a short time, it is very difficult to address that. But my editorial discusses that in detail, so I'll pass on that question. But I will add on something to the previous question, because that is more important for this theme. Because theme is business, future business, and AYUSH, So I'll give you one example. Country like Korea, small country like Korea, when electronics was not emerging, the whole economy of Korea was strengthened by just one plant, and that is Korean ginseng. The huge economy came only by one plant. And I must tell you that India has potential in ashwagandha. Ashwagandha can be a much bigger global market. Guduchi can become much bigger market. But for that to happen, it cannot happen only in isolation. Only industry cannot do that. The research community has to join industry, government has to join and support them. So we need many Hingoranis or many people like J.L.N. Shastri and Katia. We need many Katiyars in our, those who are excellent in Ayurveda, those who are excellent in the science, and those who are progressive, So unless we come out with a strategy, and this has to be extremely strategic, so a person like you has to get involved in giving or tying up all the threads together and make a proper business plan, Now in next 10 years time, how top 10 medicinal plants of India can become global. And to achieve that, we should do everything, whatever is needed. Today, we are not doing it. Dangayach ji, I'm sorry to inform that if our proposal to compare ashwagandha with hydroxychloroquine, which we proposed in month of April, would have been accepted, today, I can tell you that ashwagandha would have started becoming a global drug, today. Because yesterday only I have seen the results of this comparative clinical trial wherein ashwagandha has performed excellent. We are going to now publish that. But these results, imagine if we would have published 3 months ago, the whole scenario would have been different. We have lost that opportunity. And we have lost that opportunity because myopic view of our own people, which is sad. We have to change that. We have to be open. So, although late, I'm sure that I have great hope in our entrepreneurship, and the spirit of our industry as well. And the people who are working in our industry like Katiyar or Hingorani or Shastri, they are capable of doing it. Provided somebody like you comes forward, gives them a proper management framework, and government gives them full support.
I fully, endorse, and I fully support, Dr. Patwardhan ji, what you are saying. And I am, reminded of some people who have been able to build very successful businesses, even in a thing like yoga. Mahesh Yogi, for example, built a very big business through transcendental meditation, and he could convince by demonstrating the benefits on the neurological level or on the other levels. And we have had, the many, such people, following him. And what you are saying is correct. Entrepreneurs, the business people, the investors, and obviously the current even businessmen, large, houses, they have to come forward to look at the opportunities that AYUSH, and as I said, AYUSH has got 6 different, sciences. I mean, Ayurveda is one, but then, say you have got Unani, you have got, say obviously yoga and naturopathy, you have got, say the Tibetan system of medicine, and above all, homeopathy, which I mean, I'm finding has also got a tremendous amount of potential to deliver, obviously, healthcare solutions. I mean, both on the curative and, say maybe preventive or promotive side. All these things are wonderful. And in the current context, when the whole world is really looking for, I would say, an integrative and holistic system, I think India can provide the lead, and all of us together can look at the constraints and kind of overcome those constraints, because that is what we are all taught in the management schools. We have to identify the key constraints and then overcome them. And obviously, clinical trials or so-called, maybe evidence building, where Dr. Patwardhan has done phenomenal work, and he has created a framework. And for, say my friends here who have joined, he was the person who was tasked, who was given the responsibility for looking at all the AYUSH proposals for COVID. He was the chairman of that particular, committee, which worked, for 2 or 3 months and submitted the report. And he is also connected with the report which Dr. V.M. Katoch, produced. Obviously, he was, there on that committee as well, which brought certain Ayurvedic preparations in the protocol for treating COVID patients who are mild to moderate. And these are the kinds of landmark things that are happening. And I must tell my friends here that Dr. Patwardhan is right now busy in evolving the integrative health policy framework. Niti Aayog is doing, phenomenal work. There are 4 groups that are working: education, then you are talking about, say naturally research, clinical practice, and public health. And there is a huge opportunity to look at public health afresh now, because all the while we have been talking in the medical world about individual, the health, that is the private health. But more important is the public health, more important is the family health, wherein the integrative approach is going to be the torchbearer. And within that, AYUSH, because of the fact that AYUSH works in promotive, preventive, rehabilitative, and palliative, and to some extent even in curative. It may not be probably as pronounced and as significant in the curative part, because we have all been associating the diagnostics and surgery with allopathy, which it is not. In the very same way, vaccination is also taken as allopathy, whereas vaccines are not allopathic in nature. So with that, I would like to say that AYUSH, if pursued properly with a business mindset, I mean, I'm not saying that making profit is bad, because of the fact that we have got a Shubh Labh framework in India, and Shubh Labh framework is something which is triple, the bottom line, plus, plus, plus. It is something, which is good for everybody. And as Chanakya has always, said, and Chanakya in Arthashastra has repeatedly said that dharma comes before earth. It is supposed to be an ethical profit. The moment you make an ethical profit, which is good for everybody, we have got a Shubh Labh, which is our Indian ethos. So with that, I would like to, say that we will come to a conclusion of this webinar, in which Dr. Bhushan ji has given us such a wonderful exposition on what lies ahead of us. Dr. Mehrotra ji has given his decades of experience of transiting, from you may say allopathic, say to integrative. And then Dr. Lal Hingorani, who has built a very sound and a very sustainable business. So I would like to thank all of them, and also the people who raised so many pertinent questions. And above all, I would like to thank IIMA, ASIG, Mr. Sudarshan Jain, Mr. Ullas Joshi, and Anurag Choudhury for sharing, the kind of platform wherein people, who are today working on AYUSH and integrative system medicine have been able to come and obviously express their thoughts and share with you. So I personally believe that AYUSH is a business which is of next generation business, because because of the fact that health comes before all the four purushats, and if we are able to, to keep ourselves, well and safe and disease-free, we will be really having a very sustainable growth at the individual and the national level. So with that, I would like to take your leave and thank each one of you for a very active participation. Dr. Mehrotra ji, and after that,
just one sentence I wanted to add.
Yeah.
The vaccine, the COVID vaccine today, still offers you a lot of opportunity from AYUSH, because there are still controversies in COVID vaccine, whatever in the country and even elsewhere. Bhushan, let me compliment you on that Ashwagandha study. We should still promote. I had a discussion with Dr. Rajesh Kotecha a couple of days back, that let us come back to promote the therapeutic interventions of the AYUSH, the Ayurvedic clinical trial results. While we are allowing certain amount of the vaccination, where the first dose, everybody says is not there sufficient. Second dose, how many months will be the efficacy, and so on and so forth. We both as immunologists have understood those issues. So let's not think that because vaccine has come, therapeutics is going to take the backstage. The therapeutics of the AYUSH still has much more potential to offer.
Exactly.
And we take that aggressively as the next gen business from the AYUSH curative component, even at par or ahead of the vaccines. That will be
you have touched an important point. I'll just take a minute. In homeopathy, nosodes are intermediate to, you are talking about, say something like therapeutic, to kind of, a total, maybe immunity or immunization. So nosodes, which are low cost, room temperature alternative, low cost, can become one of the tools for providing immunization. Vaccines are providing immunization. Our immunity boosters are providing immunization. And likewise, nosodes are also providing immunization. So with that, I guess, integrated approach, and I guess a very open-minded and a scientific approach is going to do very well. And there are big business opportunities, and we will try to seize them. We should try to identify them and work on them. So thank you very much, Mr.
Narendra ji, thank you for that comment, Dr. Mehrotra. I must tell everybody here, although I am not able to share details, but I must tell you, we have just concluded a randomized control trial comparing head-to-head ashwagandha with hydroxychloroquine, and clearly ashwagandha is moving ahead, So soon the whole data will be compiled and will be processed for publication, but it is extremely encouraging, and this kind of a publication will give entirely new credibility and image to ashwagandha as well as to AYUSH. The confidence, scientific confidence in this will go very high. Thank you.
Sure. Thank you and all the best.
Thank you very much, Dr. Patwardhan, Dr. Mehrotra, and Dr. Hingorani. And I would hand over now the mic back to Anurag Choudhury for bringing an end to this interesting and exciting webinar.
Thank you, Dangayach, and I want to thank all our panelists for such an engaging session. It has been nothing short of revelatory, because many of the things that was talked about today and was discussed were things which is not part of our common knowledge, in terms of general things that people know about in terms of taking care of their own health, right? In terms of the opportunities that are available out there, in terms of the medications, in terms of the kinds of treatments that are available out there, and this entire sphere of activity in terms of the opportunities available and the challenges and how to overcome them. The entire expanse of the discussion has been really enlightening, and I'm sure everybody who has tuned in and who has listened to us has benefited from it. And this video will also be put up on the IIMA YouTube channel, and a lot more people are going to view it. And so that's why I thank all the panelists again, because their points of view and their wisdom stays there, and people are going to see it and they're going to learn from it. So thank you once again for being here and sharing your wisdom.
Okay.
Thank you, Anurag ji. Thank you, everybody.
Thank you.
Thank you,
everybody.
Thank you.
Thank you very much.